The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, Dr. Gallardo. Dr. Gallardo, welcome to the program.
Thank you very much, Randy.
All right, now, before we get into today's topic, I know you brought some models and some photos, and these are graphic photos, by the way.
They are.
I mean, they really are.
Absolutely.
Didn't even know people could have teeth like that, and then, but the afters, I should mention, are good looking.
Yes,
they
absolutely,
look good.
absolutely.
So let's start with your with your practice. I mean, who's your typical patient? What are the procedures you do?
Randy, I don't have a typical patient.
Okay.
I see patients that are 7 years old, like the child. The parents will bring them in right before braces where they need to have their gum recontoured. I'll see someone who's 107, history of heart transplant. And it's not just about the teeth, Randy.
Okay.
It's about them. It's about their lifestyle. It's about everybody that surrounds them, their families, their kids, their grandchildren. It's amazing.
All right. So now, the job of a periodontist, I mean, you do a lot of different procedures. What are they?
A lot of different procedures. By definition, a periodontist is someone who treats everything that holds a tooth in place. So I like to tell people when I see them out on the street is that I'm in the business of saving smiles. Very simple. I want people to keep their teeth. And a lot of people don't think they can, but many times they can. And with today's technology, I mean, we're doing full mouth laser treatments even for advanced periodontal gum disease. And we're saving.
So lasers now, huh?
Lasers now, and there's a lot of movement towards that treatment modality. I mean, people are scared of the dentist. There's so many people that are literally not seeing the dentist, decades of not seeing the dentist. And as soon as they find out, we do lasers, we do implants, we do sedation. We actually take growth.
So IV sedation is pretty hot.
IV sedation is, I can't practice without it, only because I know what people tell me now. They come back and they tell me, I couldn't have done it any other way. All my friends talk about these nightmare stories about surgeries and implants and everything, and then they tell me, all I remember is you saying hello and then you saying goodbye after the procedure was done and just looking into a mirror and smiling.
Well, the problem with dental implants, though, or I'm saying the problem with it, it seems very painful. Is that right?
Absolutely not. Pain is the misconception. I would say pain is
that right?
Absolutely. I mean, if patients will go and get teeth taken out because they hurt, and I'll tell you, an extraction, removing a tooth, is more painful than placing a dental implant.
Do you find that in this economy that people are investing in their smiles?
They are, when they find out how important it is. Okay? Some people are not sure. Some people think it's one thing or another, but when they realize how important it is that when someone looks at somebody's face, that one of the first things that stands out, they think it's the eyes. It's not the eyes, it's the smile.
Okay.
It's how, and you know, I always ask patients this. I say, what if you can change anything at all, if I gave you a magic wand and you can change your smile right now, what would you do? What would it be? And they always say, I wish my teeth were whiter. I wish I can smile more. I wish when I was at a restaurant with my grandchild that I didn't have to get up out of the table and go clean the food from underneath my dentures.
You asked them that question?
I do.
Interesting. You looked at those photos when I asked you that question. Is there one in particular that popped in your head or something?
Absolutely.
What is it? Let's take a look. Let's go there.
Okay. This is a beautiful, beautiful woman, but she's missing all of her top teeth. So she's missing her teeth, so basically her whole face is collapsed. I don't know if you've ever heard that, but there's a term that we use, it's called facial collapse. What happens when you lose your teeth is not only do you lose the lip support, meaning what holds the shape of the lips together, but you're basically losing the bone that once held your teeth.
Okay.
So it causes the muscles that are attached to that bone to actually get pulled in. And it makes you look, well, if you can look at this picture, she looks 20 years older than what she really is.
Is that her smile, by the way?
That's me trying to make her smile. You see?
So what, she doesn't smile at all before this?
She told me she can't. She feels like she can't. It's not possible. Even when she's happy, she feels like her musculature, her lips are not programmed to smile anymore.
Okay.
So 4 implants, only 4 implants were able to be used to replace 14 teeth on the upper arch.
Okay.
You see?
And it doesn't come in and out?
It doesn't come in and out. That's fixed.
So it's a full arch of teeth fixed?
Fixed.
Interesting.
Yeah. Over 4 implants. So it used to be that we used to think that 8, 10, some people even place 12 implants to restore a full arch of teeth. And that's no longer the case.
And how, I mean, give me the time frame. Okay, so she comes in, I mean, what's the turnaround time? How soon can she eat, or how soon does she have a set of teeth?
This is something that can happen the same day.
Okay.
This is something that can literally happen the same day. I mean, we form a team, basically, where we have me being the surgeon, a restorative doctor, and a laboratory. And we do it under the same roof, meaning our office.
So like these expressions of the teeth being done the same day, or
that's
all on four. Is that what this all on four means?
Absolutely possible.
Four teeth for the denture wear, or four implants?
Four implants to support up to 14 teeth. Absolutely.
How big of a problem is this in Florida? I mean, would you say tens of thousands of people have this?
Yes. And you know what the big problem is that most people don't even go to the dentist. Denture wearers do not go to the dentist. And you know why? Because they feel as though all their problems are over. And I say to them, their problems are just beginning. Why? Well, number one, what's the biggest oral health concern in the world? Oral cancer.
Okay.
How is someone going to know that they have oral cancer, which can turn up as a little bit of a spot, a little white blemish, something on the gum underneath the tongue? How are they going to know if a dentist doesn't check underneath?
So they don't go in for checkups.
They
Interesting.
don't go for that. No,
okay.
They hate the dentist. So they basically think that's
But if dental implants are as good as you say they are for denture wearers, just four dental implants, and you also say the 2 implants for the lower snap in, snap out, why aren't they all doing it?
Because they don't know about it, number one. They don't understand the technology, because, I mean, let me tell you this. I am practicing now completely different than what I did 5 years ago.
How so?
That's how fast technology is moving. We use growth factors for every single case we do. And it's like a rapid recovery type of surgery where we'll take, just from a simple blood test, we'll take plasma. We'll take proteins that are in the plasma. And these proteins are called growth factors. They're just little signals that trigger the cells to actually repair. They naturally occur in your body. If you scratch your skin right now, it's going to start healing because of these growth factors. So we're using this to actually accelerate healing. I'm actually taking implants and I'm dipping it into the patient's own growth factors just seconds before putting it in. You see? So we're getting faster integration, which basically...
But why is it used to take like 9 months, and now, you could do it in a visit or two? I mean, what's changed with dental implants?
The dental implant itself, number one. The surface of the implant is much more sophisticated. The actual techniques, for example, when we talk about 4 dental implants, we're talking about implants being placed in solid bone. Now, before, we wouldn't think that way, because we would have the issues with the low sinuses, not enough bone here. You would have to go through major surgery, hips, chins, transplanting bone.
So that's behind you?
That's behind us.
And imaging. Now, what about imaging?
Oh, imaging is what makes that all possible, too. Because what happens is we have a CAT scan in the office.
All right.
And basically what a CAT scan does, it gives us a 3D version of the patient's jaw. So we actually do a virtual surgery prior to that. So when I come in and do that surgery, I've already done it, not just in my mind, but on the screen. So I know what implant I'm going to be using.
Is that right? I mean, that's not, an expression. I mean, you're actually, you've pre-done the surgery.
For every case.
Is that right?
Even for the single implant.
And not everybody does it that way?
Not everybody does it that way, but what we've done is I want to say that we've created our own standard.
Does it cost more to go to a specialist? I asked your partner the same way, because I guess general dentists could do dental implants. And this, by the way, if you're just tuning in, this is not an endorsement for you. We just met a couple of hours ago. It's a real interview.
Right.
But does it cost more to a specialist?
Not necessarily.
Okay.
And it's all relative. And sometimes when a patient speaks with me about cost, or this is this, or
because you're all getting the implants for the same price anyway.
We are. But
Okay.
it's not just about the implant. It's not just about the implant. It's about the experience. It's about how we build up the bone. It's about what's possible.
Okay.
You see, so what's possible in one specialist's hands maybe is a little bit different than in another practice. Now, I don't want to say anybody's better than anybody else.
But it's about the same price wherever you go.
I would say it's about the same price.
So you might as well go to a specialist. Because when people email me all the time, they'll say, I want a referral here. And our wellnesshour.com website is not a referral site. So we don't give referrals. But I do say go to a specialist, whether that's a knee guy or hip or whatever. Very interesting. So now, how big of a so denture wearers, they benefit the most. And this woman, okay, so with this one, what'd you do? Okay, so you gave her upper
Basically,
implants.
gave her,
Okay.
Gave her an upper implants, 4 implants, and this is what happened.
It's very nice.
It's complete transformation. I would say that the most important thing for her was the confidence in being able to chew anything she wanted.
All right.
Prior to this, she couldn't eat anything solid. I'm not exaggerating. She couldn't eat anything solid, so she was basically on a liquid diet for most of this period of time. See, so after this, now she can eat steak, she can bite into apples, she can eat anything she wants and still have that confidence.
So they don't come out. I mean, they feel like they're regular teeth. And
they feel like they're regular teeth.
How do you maintain them? The same thing? I mean,
it's
you floss and brush?
Yeah, the flossing might be slightly different, but other than that, it's really the same thing.
Okay.
And you still have to visit the dentist, but it's a pleasant visit.
Is this one of those things where they say I should have done this years ago?
Everyone. We interview patients after because I want to know. I want to get the feedback, you see, for future patients. I always say, what is the one piece of advice that you would give other patients who are facing this same issue, the same problem? And I say whether it's one implant or their full mouth needing implants. They always say, they look at me and say, get it done now. Don't wait. And I agree with that. You know why? Because it's not going to get any less expensive, and it's not going to take any less time by waiting. The problems just continue to compound themselves. So
now, most of your patients come from a general dentist, right? The general dentist sends you do the surgical part, they do the other part, you work together, so they don't have to switch dentists if they do have a dentist.
Oh, no. Okay. As a matter of fact, even for these large cases, we encourage the patient to stay with their dentist, because what we do is we form teams. We form these specialized teams where we get together, we study the cases, we look at the CAT scans, and we really formulate a very specialized treatment plan for the specific patient versus a cookie cutter type of, same thing fits all. So that is really the best bet. Plus, the patient feels comfortable, and they feel as though they can continue the maintenance process afterwards with their family dentist.
Now, and many of these patients, you guys are using IV sedation. Is that right?
I would say over 90%. Over 90%. Now, we don't insist on it, but once they talk to other patients and once we tell them that it's available and what that means.
So you're asleep during the procedure.
You're asleep during the procedure, but we keep it at a safe level, by the way. So we keep their reflexes intact. They can cough if they have to, if they're uncomfortable or their back.
So not all dentists, by the way, have this certification that you have or license for IV sedation?
No, it's actually a separate license that we have in order to do the IV sedation. So it's been remarkable. And what it does is that, more importantly than the procedure itself, is actually has brought out patients that haven't seen a dentist for over 30 years. Can you imagine that?
Really?
Not having seen a dentist in 30 years.
Okay, now it's just because they're fear of the dentist, or what is it?
Petrified. And all it takes is one bad experience.
What are the categories? Let's move right in. What are the different categories of dental implant patients that you see?
Okay, as far as dental implant patient, it could be a single tooth. For example, a young 20-something-year-old sports accident, football, skateboarding accident, knocked out the front tooth, comes in to see me. Okay, and the biggest fear that they have, by the way, is that, oh gosh, I'm really scared. This is my front tooth. I have a high lip line. When I smile, you see everything. And I've always heard that implants don't look natural. And I tell them, I don't tell them anything. I show them pictures.
Okay. And all these pictures are on your website?
Most of them are. So we can make a single implant look as it, well, you wouldn't be able to know.
Okay.
You wouldn't be able to know which one's the implant. And after a while, you know what happens? When I'm doing an exam, a follow-up exam years later, I'll ask the patient, well, where's that implant we placed? And they even forget which one it was.
Okay.
So that's how...
It's like having their own tooth back?
It's the most natural way to...
The other categories are what?
Okay, so single missing tooth, multiple missing teeth. You can be missing 1, 2, 3, maybe a full quadrant, maybe a few on the bottom, a few on the top.
So the other categories are what?
Other categories, you can be missing teeth in one particular area. For example, you might have old dentistry, an old bridge that you don't know what to do with, or you're afraid to even make a transition from that old bridge to something new. So we can have that. You can have someone who's maybe missing one complete arch of teeth, or maybe all of their teeth. So it's basically everything else in between. Now, as far as missing all of your teeth, you can basically have a patient who just lost their teeth and has dentures. Maybe they've been wearing dentures for a few years, maybe up to 5, 6 years. And that could be the 70-year-old, for example. And they'll stay with the dentures for some reason because they think they're too old. And they're not.
I told your partner, I said, my mother, because I told her about dental implants. I've talked to you guys and another dentist, and she says, my doctor said I was too old. She's 74 years old, or 75 years old. And you say that's young.
That's young.
To do it.
That's young. You know, one of my biggest regrets is that I became a dentist in 1991, and I wasn't trained when my grandparents were alive. Okay,
and they had dentures.
They all had dentures. And one of the rituals that we had is my grandfather and I would go out to dinner every single weekend, and I just remember him struggling with those things. And I remember asking myself, why isn't he ordering the same stuff that I'm ordering? Why isn't he ordering that nice steak that he always talks about? It's because he couldn't eat it.
Couldn't eat it.
Couldn't chew it.
Do they confide in you on these consults, these denture wearers? All the things they can't do?
They really do. They really do. I mean, not off the bat, but what we do is we actually start to ask questions, and then they open up.
Is there such thing as a happy denture wearer?
I haven't seen one. I haven't seen one. Even those patients that have been wearing dentures for most of their lives. I know one guy, or patient.
All right. Okay.
He basically has 7 sets of dentures sitting in his drawer because he always thought that the previous dentist just didn't make the right set of dentures, or it was a bad dentist. But then he realizes it's not the dentist, it's the denture itself. The bone continues to wear, it atrophies, it shrinks. If you don't use it, you lose it. You know, you've heard that.
Okay, I've
So
heard
the same
that.
thing happens in the mouth. Just like the long bones of the legs. Bone in the jaw respond the same way. If you're not creating function or a load that transfers into the bone, and that can only take place with two things, either a healthy tooth or a dental implant. Everything else, whether it's
So the pressure of the implant or the biting forces keep the bone.
it maintains
there.
the bone. It gives it work.
What if somebody says, I don't have enough bone? They're in their 70s.
Well,
They've been in dentures, like my mother, since she was 28.
I rarely see a situation where I can't place implants.
And you say over a 100-year-old came in
Yes.
and got dental implants.
You know, there's actually studies that show that
That seems painful, though. That's got to be
Well,
painful
but
for that person.
It's not. It's not. Listen, they tolerate the same thing that someone in their 60s.
So the bone doesn't have any pain.
The bone has no pain.
Okay, you brought photos. I mean, these are graphic photos, and I'm going to warn people. I mean, your afters are really good, but these are graphic photos.
They are graphic, but this is a gentleman who
Unbelievable.
he literally flies in from South America. He's a very successful businessman, and the irony of this is he has not seen a dentist in 35 years, and one of his businesses is basically it's basically a series of dental offices. He owns dental offices.
So that guy owns dental offices.
He does.
Well, why wouldn't he do it then?
He's been afraid. He came
Like embarrassed to go to his own company?
embarrassed and just petrified, because of past experiences.
So this phobia of the dentist is really that big
It's
of a
so
deal?
extreme. This is one of the most extreme situations that I've seen as far as phobia. I remember the first time he made an appointment. He came in, he sat in the waiting room. He lasted maybe 5 minutes and said he had to
And he left.
reschedule. He didn't even make it through the door.
Is that really the norm, though, or is that rare? I mean, people are that afraid of this?
You know, there's a lot of people that are afraid because they just don't know.
Well, what's going on there? I mean, what is that?
This is everything. It's a combination of everything. Advanced periodontal disease, gum disease, root canal problems, moving teeth, sensitivity to hot and cold, not being able to bite.
So what does he do? Does he hide this smile?
He hides his
He just
smile,
never shows it,
but
obviously.
he's in constant pain also because the force of the teeth just coming together is painful. Imagine that. Forget eating.
All
He
right.
can't even.
So
put his
those teeth
jaw
all
together.
had to go.
They all had to go, and he was aware of that. He knew that, and I think that's what kept him from coming in. But finally, when we got started, let me tell you, complete transformation. Complete transformation.
What'd you do?
In one appointment.
Okay, one appointment.
Under sedation, all teeth were removed, and he basically had a full new smile by the end of that appointment.
Okay.
And these were just the templates.
How many implants? How many implants?
In his case, we actually did 8 implants. So that was a full case.
Like 4 on the bottom,
No, we actually did 8 on top,
8 on top.
8 on the bottom.
Okay.
Okay,
So that's what he wanted.
that's what he wanted. That's what he wanted. So and we talk about how sinus grafting and all these grafts of the past were painful and scary and all. With the growth factors, we make.
What if your
everything-
gums are too bad for dental implants? I had that question.
Once the teeth are removed, the disease is gone.
And the gum gets healthy?
The gum is healthy instantly. The bacteria is stuck on the root of the tooth. It's not stuck in the gum. So
Okay.
as soon as, these teeth turn into foreign objects. It's almost like having a nail in your foot. Once that's out, it's over.
Interesting. The infection clear. Okay, let's take a look at this after. What's going on there? This is
So
Okay.
immediately,
what a difference.
this man was in tears. This man gave me the biggest bear hug you can imagine. Okay, and this is someone who
Yeah.
didn't want to step into the office.
It's a fixed set of teeth.
Fixed set
One
of teeth,
appointment.
One appointment, and healthy.
How soon could he eat?
Patients can eat that same night.
Okay.
I'm telling you, they can eat the same night. Of course, we're going to modify their diet at first.
But within weeks or whatever, they could eat
Absolutely.
apples, they could eat
Yes.
steaks.
As soon as those implants bond, fuse to that bone. Now, remember, they fuse to the bones. It becomes part of your jaw. People don't even know it's
Now, a guy
there.
like this, do they say, I should have done this years ago?
Yes, but he also said, I'm really glad I found the right place. He really said that.
How do they hear about you? I mean, the guy's in another country. On the internet?
There are on the internet is one thing, but also there are patients that just talk to each other. People, and word gets around. And I've been doing this since 1991, so it's been many years now. So people really start to talk, and the thing is that
so when you want dental implants, Gallardo and Lamas, you got to go see those guys, right?
It wouldn't be a bad decision.
Okay.
Yeah.
What else are we looking at over there? There's another one. Boy, that's bad. That's bad.
This is a case.
I mean, it's hard to believe these are common, though. I mean, you never see these things. I mean, you don't. I mean, this is not.
Because people are hiding their teeth. They're hiding their smiles.
Okay, that's right. Okay.
You see, they come across as rude, as arrogant, but they're not. They're not. They're some of the most insecure people, unfortunately, because of this. But I tell them, you're just one appointment away from having this all go away.
Is that right?
I really say that because I mean it, and I promise people that.
So this person is, all those teeth have to go.
Can you guess how old this patient is?
Looks pretty bad. 60, 70, 50, I don't know, 70.
26?
26, okay.
26, okay. So this is a very advanced dental case. So decay everywhere. Dentists ask me, can we save some of them? Can we start filling some? But the patient said, no, I don't want any of them because it's been a source of constant fear, constant pain. So what we did was we removed the teeth and we basically placed implants in substituting those teeth. And the teeth were actually placed.
Doesn't look like the same guy.
It's not. It's not.
Okay.
He walked out of there that same day with a brand new smile. He smiled for the first time. His mother called me. Even wrote me a note and said, he's smiling for the first time. Everyone around him sees him as a different person. He got...
Well, looks healthier. I mean, you can't really see the whole, his whole face.
Well, he is healthier. He is healthier. And I'm not exaggerating when I say this. New job, new girlfriend, turns to fiance.
I hope she's not with him just because of his teeth.
Well,
no, I'm kidding. I'm joking. Go ahead.
It was such an impact, and this is so touching for me. They actually invited me to their wedding.
Oh, is that right? That's a good story.
Yeah, they invited me to their wedding, and the mom, the dad, everyone just surrounded me, and I felt as though I was a stranger there because I didn't know anyone. And they went straight to me and was like, "Thank you so much."
So a lot of these people out there that what do they think? There's nothing that can be done? I mean, do they go in there and say, "Doc, you've never seen anything like this before in your life"?
They do.
They do. I mean, really,
that's what they do because they don't know. They don't know. People don't talk about these things. You see, unless it's very painful, too late, it's an emergency situation.
Okay.
But I tell people, don't wait till it gets to that point. You know, that busy executive that flies from country to country. It's like, don't wait. You might be at a meeting, a very important meeting, and at this inopportune time, all of a sudden you have a dental emergency. Then what are you going to do? Take control.
Okay.
That's what I tell patients. Take control.
And it doesn't have to hurt because you have IV sedation or whatever.
IV sedation. We use local anesthesia.
Okay, the denture wearers. When we are out of time, let's talk about their options. By the way, okay, so they're without teeth. Let's go over what the options are.
Okay, the denture wear. Basically, what I consider the standard of care.
Okay.
Is not a denture. 2 implants to me is really the standard of care.
So just 2 implants, and they go right there.
Just 2 implants.
Okay.
Just 2 implants right here, right in the chin area. The reason why we do that is because that's where the bone is the strongest, and that's all you need to be able to have a retentive, or basically a denture that stays in place. And the rubbing is gone.
Let me see that.
Actually, don't take a look at it, but also try to remove it.
Okay.
It's only 2 implants.
Okay.
How was that?
Looks pretty good. Now this right here, and I saw this also with your partner, that this is like a denture, but it has snaps.
It has snaps.
And it just snaps, and this is pretty accurate of what's going on. It just snaps in.
Absolutely.
Is this about how snug it is?
Oh yeah, absolutely. As a matter of fact, some patients in the very beginning, they have to get used to it. Some of them can't even get it out of their mouth.
So no more glue. I mean,
no more
adhesive.
glue, no more adhesives. No more adhesives, which is something that they love.
I mean, just 2 implants, has to be a lower cost. Why? With denture wearers watching this, just 2 implants. The reason they don't do this is what? Just fear? Just fear of pain? Fear of the dentist? They think they're too old?
Fear they're too old. Fear it's going to hurt. Fear of they're on too many prescription medications, too many medical complications. No, we see all of these patients. This is such. I actually did a case like this, and I said this earlier in the show, on a heart transplant patient.
Okay. Wow.
Okay, just like this, changed their life. It really did.
Because they could eat, they could chew.
They can eat, they can chew, and they
so lowers the big problem, right? I mean, it slides around in their mouth.
Definitely lowers the big problem.
And 70, 75 is young today.
It is. You know, there was a study out of the University of Florida back in '91, and they classified denture wearers as handicapped people. Can you believe that? Yeah.
Okay.
Yeah, because you have 25% of your chewing force is left when you wear a denture. 75%.
Okay, but fixed. Now the next level is getting something fixed. You call it like an all-on-4 procedure. Is that what we're talking about here?
Yes.
And that's for something that doesn't come out. I mean, that's what everybody wants.
Exactly. That's for something that doesn't come out, and everybody does want that. This is basically 4 implants supporting, like I said, 14 teeth, and this is delivered the same day as the procedure.
Same day. Sounds
day.
like an exaggeration.
It's not an exaggeration.
Okay.
Not only that, but they get this, and sometimes they can use, if they've recently had a denture made, if that denture is in good condition, we can actually use that.
Use their old denture.
And transform that into a fixed, you see, and cut away the palate, which is the worst part. You see, patients hate the roof of their mouth when it's covered.
Okay, that's a good point.
Yeah, they can't taste the foods. They can't.
So the roof of the mouth is covered on a denture, and
Completely.
And so with dental implants, like 4 or 6 implants.
4, 6.
Okay.
Yeah, we can actually get a fixed case.
So everything, you know, for the most part, as far as imaging, is done under the same roof. So somebody watching this, and I'll put you on the spot here. Okay, in an ideal situation, perfect scenario, 70-year-old, they have a denture, they've been in them 20 years, in just a few appointments, can get a fixed set of teeth.
And it's over. The only thing that I ask is if when they call the office, I want them to keep trying, because sometimes we get a little bit busy.
You get busy.
We get a little bit busy, so I don't want them to give up.
You need operators who are standing by.
Yeah, I mean, if the appointment coordinators are a little busy, I want them to call back. It's going to be worth it. It's going to be worth it.
All right, so give them a call. And final message, though. Somebody watching this, the denture wearer, they're just afraid, or they don't believe it, or whatever. What's the first move?
No more dentures. Say to yourself, no more dentures, that you deserve better. You deserve better.
And go to a specialist.
Go to a specialist.
Do you think they should go to a periodontist?
I mean,
is that your opinion?
I consider myself a quarterback in a way.
Okay.
I want to help develop that game plan.
All right. I want to thank you for coming on the show. Good stuff.
Thank you.
Great. And all this is on your website, more information. And consultations, how much are those? They're free, right? I knew that.
No charge.
So thanks again. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. Gallardo or dental implants Miami, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.